this lab, we're going to be looking at 4 projections of the hand, the PA, the oblique, the extension lateral, and then the fan lateral, okay? Hand and fingers are all done tabletop. We are not detenting our tube to the ceiling, to the wall bucky. We're not detenting at all. Table top is this button. It's got the line above the top of the table. So for all of these exams, make sure you're on tabletop. Our distance, what's our SID going to be? 40-inch SID. Tabletop, we want to raise it up. Our patient's going to be sitting in a chair at the end of the table. Some of our wall buckies do roll up to where you could do tabletop work on the top of them. We're going to do this on the table because not all of them do that. Patient is turned where her legs are to the side. We do not want the reproductive organs under the table or under the beam, right? So this is a radiation protection. She's got her shield on, which we would always shield on all upper extremity exams, okay? There's several ways you can do these images. Tabletop work does not use a grid because the body part is not more than 10 centimeters thick. So we don't need a grid. You can either, there's 2 ways. I'm going to show you what I prefer first. I'm going to let you just relax your arm up in your lap. This is what I do most of the time. I go ahead and take my tube and I align it to my IR because you have to have the 3 things aligned. What are they?
The IR, the tube, and the patient.
The IR, the tube, and the part. So, first thing I'm going to do, careful down there. First thing I'm going to do is, do you see these little notches on each side of the IR? I need to make sure that my tube and my lines, now remember this tube head can turn any direction we want it to. So I want to make sure that it is lined up so where each line crosses each of those little notches there. So you can center your tube to your IR first. If you have a patient that's real easy to work with and you know they're going to be able to move their hands around, then all you have to do is put the part in the center. If you have a patient that comes in and might be kind of difficult to manipulate their hands or fingers, you can go ahead and put the part on the IR and then bring your tube to line it up in the middle. It's fine to do it either way, okay? I'm going to show you this. So for hand, where am I centering? Where is my central ray for the hand?
The MCPs.
Which one?
The third.
Third metacarpophalangeal joint. With the hands, fingers, wrists, no watches, no bracelets, no rings need to be on. If the patient's hand or fingers are real swollen, you're not going to be able to get them off. Okay, so you would leave those on. For PA hand, which is what we're doing, we're centering to the third metacarpophalangeal joint. Metacarpals, phalanges. That's where it needs to go. The fingers need to be equal distance apart. This line should be coming as close to the middle of the wrist as possible. You might have to just kind of manipulate it over just a little bit. And then marker, you're going to do, this is which hand? Her right hand. So I'm going to put the right marker on the right side of her right hand. Collimation is 1 inch on the sides, and then 1 inch past the carpal bones, or more specifically, this little area that sticks out on your wrist right here is called your ulnar styloid process. Does everybody feel that? It's going to be closest to your 5th digit. You need to make sure that is included. You want the distal end of the ulna and the radius included in this hand x-ray. Okay? That's a PA hand. Questions about that? If I've got my IR and my tube centered, let me find my sponge that I know where it is. If I've got my IR already centered, then I can just move my part, right? I've got those two set up, so the third thing is the part that can be moved. Most facilities have these, some don't. This is an oblique sponge for the hand. You can put it right underneath the patient's fingers. Take the thumb, wrap it right there. What we're trying to do here is oblique each of the fingers. Still got to center to the third metacarpophalangeal joint. Look how that spine nicely separates each digit and the thumb. Still centered at the third, but look at her thumb right here, y'all. See how close I am to the edge?
Can we go out?
Yep, need to open that collimation up. Also making sure I'm still coming through the wrist. Notice that there's a little bit of an angle towards her elbow. If that's the situation, you might want to prop her elbow up on something. Because with the hands, we are including the wrist and the carpal bones. If there's any angle to them, it's going to close the joint spaces. And then lean in just a little bit more. Just messed us up as far as the... Going back to make sure I'm centered. Always check and make sure you're centered up to the notches on each side. Third. And you'll be kind of coming in a little bit in front of the third because you're shooting down into it. Wrist is good. Got my marker. I can come in a little bit more on the side now. That's my oblique hand. Questions about that? Okay there. Next, we're going to do the extension lateral. This one is done to look for foreign bodies. Maybe she has a piece of lead from a pencil stuck in her hand. So we extend the digit straight out. The wrist has to be in a true lateral. I want that radius and that ulna to be right on top of one another. Okay, one of the biggest things that I see students do is allow this wrist to roll forward. It has to be up on its side in a true lateral, and then we just bring the thumb out and collimate in 1 inch on our sides. Extension lateral. Notice I'm still centered to my IR. My part is centered. I'm now centered at the second metacarpophalangeal joint. So third metacarpophalangeal joint for the PA and the oblique. Second metacarpophalangeal joint for the extension lateral. The next lateral that we do is a fan lateral. I always start with my hand in the extension lateral, and then I separate each finger because I don't want that wrist to move from its lateral position. And so I'm trying to keep each digit lateral and bring the thumb out. Look at your shadows to make sure you don't have any overlap of your parts or your digits. Still coming in, second metacarpophalangeal joint. Wrist is nice and lateral, and I've got each digit lateral. That's an extension lateral. Remember when you used to do those little shadow puppets on the wall with your fingers? It's kind of what it reminds me of. So each finger, the fingertips cannot dip down towards the IR. They have to be nice and parallel to the IR, okay? I don't want one straight up in the air. I don't want, I want them straight out. So we're trying to give them as much room. Okay. 1 inch collimation past the tips of the fingers, on the sides of the fingers, and 1 inch past the carpal bones. Questions about that?